Okay, so far we've talked about pain management. We've had a lot of questions, a lot of very good questions. Reno, I'm kind of curious if there is a case maybe that you did last week or last month that's been very interesting to you, very unique.
I've had a few really great ones recently, some really complex cases. One of the ones that kind of stuck with me last week was a very lovely young lady who came in now about 5 months after a motor vehicle accident. And her original injury was neck pain. She had a really severe collision, was forcibly pushed back in her seat and had more of a hyperextension injury. That got better, but her back was bothering her too. So I found her to be incredibly good historian. She gave me a good description of what was going on with her. And the reason why this is germane to our top conversation today is that this is a classic person who would normally just kind of wallow out there. We're talking about 5 months after an accident. Her internal medicine doctor, well-intentioned though he is kind of sat on it because he didn't know what else to do with her. She's a young lady, she looks good, the x-rays look good, the MRI look good. Figures, well, it'll eventually go away. But we're talking about 5 months now, and meanwhile, she's suspended running, all exercise, in fact, and is starting to get depressed. And I found her to be just the ideal patient for us because there's a lot we can do for this young lady.
How about you, Robert? Any particular case?
Well, a case last week, which is interesting for me because they're ones that we can profoundly help. And these are people with migraine attacks. Typically, a patient with migraine would go to the emergency room or would take some migraine medications, but we're actually treating these people in our office. So this gal came to our office, and we do a kind of last minute. She called last minute, we got her in, we start an IV, and we give them some kind of acute headache-breaking medications that can break the migraines in the office.
So many people have migraines. I had a nephew that they were so bad that he would vomit and become very, very sick. A, are there more migraines, and B, are there new medications like you were just talking about that are actually helping?
Well, interestingly enough, the most exciting thing right now for me in pain management is this new migraine therapy. It's called the Reed procedure. It was invented by a doctor here in town, Dr. Reed, and it's revolutionizing migraine therapy.
Fantastic. People call if you have a migraine problem, and the doctors will certainly be able to help you or refer you to someone that can do as much as can possibly be done.